Guys, welcome back to Medical Coding with Blue. Today's episode is all about should you pursue a career in medical coding? Some things to think about. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So, occasionally, and I mean a lot lately, but occasionally I will get messages from people who have been established in their careers and they're wanting to transition over to coding. And one of the first things that they look at is, I have to take a cut in pay. Okay. Now, I am never here to sell the field of medical coding. Never. Do I believe that all people can do medical coding? No. I do think that there are some people that they have no business being in this field because this field requires a lot of continuing education. And some people don't want to do that. They want to get certified and they want to be told what to do. They don't want to do critical thinking. And that just does not work for this field. If you are unwilling to commit more time to studying, even after you've been certified, this is not the field for you. We have to know what doctors know while never having gone to medical school. That's my saying. I've said that. And it's very true. And I don't say it to scare you because often people will become frightened because I say that and overwhelmed. It's not an overwhelming thing if you know what to expect going in. Yes, we do not see patients. Yes, we don't have to know all of these intricate things. However, we do have to be able to interpret what's being said in medical documents. And that takes some knowledge. It takes some skill. It takes some critical thinking. But I did get this message from this person. I'll read this. But I will say this. If you're sending me these kinds of messages, guys, know this. I am not going to sell you either way. I'm going to tell you what you should know going in. The only one who can make a decision about your life is you. Whether it is that you're switching careers or you're thinking of a career or you haven't worked in years and now you have the opportunity to work and you're just wondering if you should pursue this. That will always be a personal decision. And whatever it is that you decide to do, you have to consider all of the variables. You have to consider your home environment. You have to consider your own energy coming into this. You have to assess everything and you have to make that decision on your own. If you want to pursue this and you want to commit yourself to all the learning that is needed, not possible, but needed for this career field, you can do whatever it is that you set your mind to. However, you have to know that it is going to be a lot. Okay, so let me read this and we'll get into it. So here we go. So the viewer says, I have a question. I work in a small hospital in the sterile processing department. A position has come up for a health information tech. I applied and the manager and I feel this is a good fit. However, HR explained that the position is entry level and I would make significantly less money. I am 40 and I want to change career paths and do this, but I am scared to leave my position because of failure. My bills are paid. I don't have any lingering debt. I could reasonably do it and get tuition reimbursement and really excel in the position, but I don't know. Any advice? I was a secretary and a leasing agent for 10 years and I still do leasing part-time. Well, here's the thing. When it comes to HR says that this is an entry-level position, so you're going to make significantly less. That's a load of bull because HR knows better. HR knows that your entry-level salary can always be negotiated. Now, will it be as much as you're making currently? Probably not. Why? Because sounds like you have had years doing sterile processing. So there's always a little bit of wiggle room. You would have to be willing to go in with a figure that you know is going to be fair to you and maybe meet somewhere in the middle of where they had their entry level starting salary plus somebody who has versus somebody who has experience. So even though you're brand new and you're still getting experience, you still need to talk up all of your skills that you're bringing over. You're not coming in without medical terminology knowledge. You are not coming in without surgery knowledge. You are coming in with all of this knowledge. So that knowledge is valuable. And with that, like I said, Even though they say, oh, it's significantly less, it may be significantly less than what you are being paid right now, but you can certainly negotiate a better rate. Now, it's not going to be as much as somebody who has experience in coding, but it may be enough that you could say, okay, I can take a few steps back in order to move forward. I have said many times on the channel, there is a nurse that followed my independent study syllabus. She studied, and her whole goal, as she was a nurse, and her whole goal was to leave the bedside. Okay, we all know nurses make good money, okay? But her ultimate goal was to get to CDI. But she had heard me when I said a CDI needs to know coding first so that you have some knowledge when you get into CDI. Well, she listened to me. And so she got her a coding certification. Then she worked 2 years, and then she got into CDI. And now she's making more money than she made as a nurse. So I know of what I speak of when I tell you guys these things. So sometimes you may have to go back in order to move forward. You're not going to get the same amount of money that you've been making. If you're coming in from another industry, or you're coming in from, some other part of the medical field and you're trying to get into coding, you're not going to make the same thing. Don't expect that. Why? Because again, you had to spend years to get there to make that kind of money. And to come into coding and thinking you're going to make about the same thing is foolish. Let's be honest, see what it is. That is foolish, because again, you had to get all that experience in order to work up to that, and everybody pays differently. All right. But if you're coming in and this person, I don't know if they have a certificate. No, they don't have a certification. Don't have a certification. So what do you think? What do you think is going to happen if you're coming in with no certification? Right? You're not going to get the same as somebody who has a certification. You haven't even been through a program yet. You say, yeah, I can go through tuition reimbursement and that kind of thing. Obviously, there is something here that is prompting you to move. Oftentimes, the universe will tell us when it is time to move. We will become increasingly uncomfortable. There will be something that will happen that will redirect our path. You have to pay attention to those signs. You have to know that just wherever you land, that may not be your forever home. And wherever you start on the pay scale is not where you will stay. I have said this story probably 200,000 times already. When I first started, I started at the Cancer Therapy Research Center. Now, I thought that was great starting salary that I got. It was a 3-month assignment that I got through a temp agency, okay? Now, there's no national brand of a temp agency, so you have to look in your area to see if there are temporary agencies for medical professionals. That's what you want to put in to Google when you do that Google search, okay? Temporary agencies for medical professionals. Those temp agencies are going to pop up, and sometimes they compete for contracts for coding. And that's how you can get your first job, your foot in the door job, is being able to start somewhere. You want to get experience on your resume, and every assignment that you get put on is going to be filler for your resume. Just something to keep in mind. So I was there for 3 months. I did not get selected because there was 3 of us that were competing for the long-term spot. I did not get selected. But guess what? I went back to the temp agency. They told me, okay, we don't have anything here in town, but you would have to move. Do not tell me you cannot move. I don't want to hear it. I don't want to hear it. Every time I would tell a story, though, I always get somebody, I can't move. I'm not asking you to move. I'm telling you my story and what I had to do. So I had to move away. My mom helped me to move. She helped me get my apartment, everything set up. And so I was there temporarily because, again, this was supposed to be a long-term assignment for 5 years. They had the contract for coding for 5 years. But in the meantime, in between time, 6 months into this assignment, I was getting an itchy finger. I'm like, okay, I have got to move. I have got to do something, because I wanted to get back home to my mom. That was what I wanted. That was my whole goal, was to get back home to my mother, because she was sick and I wanted to be with her. So with that, I applied for any job that I could that was in my hometown or as closest to my hometown as I could possibly get. And that is where I got my forever home job. Now, again, at 6 months in, I was already applying. At 8 months was when I ended up getting a job, because I did get the interview at 6 months. I did not get a call back, even though it was a really good interview. But when I applied again for another position, but it was an even better position, then I was able to get here to my forever home, and I've been here ever since. So it's all up to you. But I will say this: I started at one salary. I went and bumped up quite a bit, not just cents. These were dollars that I bumped up the second time. And again, I bumped up the third time. And this was all within the span of 1 year. So if I was so steadfast and so, oh, well, I'm going to make less money, would I be here with all of you? Probably not. So again, we need to have realistic expectations coming into this career field. And if you hear these things from these people on Facebook or Reddit or any of these things out there that they say, oh, nobody pays and blah, blah, blah. Okay, so you expect somebody to just pay you high amounts of money when you don't know what you're doing? You still need training on the electronic health record, and you still are trying to find your way with the coding. You expect people to pay you high dollars? Okay. It's not realistic. You have to earn your time in, and that's how you end up going up in pay. But I will say the thing that nobody wants to hear is that your pay, when you have experience, your pay starts to turn into how much knowledge do you have. That is how I got my forever home job here, because I had a lot of knowledge. My second job, I worked inpatient professional services, which that means the patient is staying in-house, but a outpatient provider comes to visit them and take care of them, and I bill for that. I make sure that that provider is getting paid for their services. So it's inpatient, but it's outpatient. And sometimes it's not the easiest to understand. And before I had gotten there, they said that they could not keep anybody in that position. So they were offering it to me as a way of like, hey, we have this availability, but people don't last here. Well, I have no choice because I moved hours from my hometown. I had no social network going there. I knew no one in that city, no one at all. And so to go there and to do all these things and learn all these things and to figure stuff out, trust me, it was a lot of learning all at one time. But it wasn't without its purpose. Its purpose was to shape me into the strong coder that I am now. Because again, when my future boss saw that on my resume, that's what I was doing, okay, that's what I need. Because that's exactly what I did when I came here, was I worked for inpatient professional services. And so that's the thing that you start to do when you move into your career. And because I knew all of that, and I was a good candidate because I had all the knowledge, I did the phone interview where I'm telling them about my knowledge. And so with that, I was able to get hired at a higher salary. So again, looking at the career itself and what does it require, and as long as you're putting that effort in so that you can get that knowledge, because trust me, there's a lot to coding. It's not just like looking up a word in the dictionary. Certainly not at all. There's rules, and there's a lot of things. There's sequencing. You have to know about different procedures, and then you got to know about different insurances, because different insurances require different codes. Medicare, when it comes to the colonoscopies, are different from those commercial insurances. I'm just saying, for colonoscopy codes. So those are the things that you have to know, but you will learn those as you get in and with time. It's not anything to panic about. But like I said, this person got interviewed. The manager and her both feel that it would be a good fit. If you're in this same situation and you just don't know, sometimes you have to step out in a leap of faith, because the only one who can have faith in you at the end of the day and it can make any kind of impact is you, right? You have to have faith in yourself, because you have to have faith in yourself and your ability to be able to adapt. I talked about being able to adapt when you're in this when you're in this field. It requires a lot of adapting because we do have updates, not drastic updates like when we transition from ICD 9 to ICD 10, but we do have updates that occur when the codes get updated and things like that. So, I mean, again, if you're staying on top of it, it's not so scary. None of this is scary. I can say that because I have experience, yes. But again, if you're brand new and you're listening, you're paying attention, it's not going to be scary to you either because you have the benefit of listening to somebody who has years of experience. Whereas I did not have this when I very first started in coding. There was nobody like me, still nobody like me, on YouTube to give this information to you guys and to tell you that this is a real deal. This is what the industry is about. This is, all of these things. There was nobody like that. So again, if you're doing your research and you say, well, this is something that I want to do, and I've told you guys many reasons why you shouldn't do it, okay? And I always talk about more like why you shouldn't do it because, again, I'm not here to sell the field because there's plenty of people that already do that already because it's a business for them. It's a business and they get money from it. So for every class that they can sell, for every program that they can sell, they get money from that. I get nothing. I have no relationships with none of these schools. So I'm just saying that up front. I don't sell credentials. I don't do any of that. Because to me, you just need one of the 4 main medical coding certifications. The CCS, the gold standard of medical coding credentials, the CCA, the CCSP, or if you're going AAPC, the CPC, okay? The first 3 are with the American Health Information Management Association, and that is the association that I belong to. Now, I always talk about AAPC as well, even though I have nothing to do with them. I will never be certified with AAPC because I have everything I need with AHIMA, okay? But I'm not saying that it's one over the other, guys. They're both respected in the industry. It's just that they have different business models. AHIMA is a non-profit organization, whereas AAPC is a for-profit organization, which is why there are tons of products on their website to buy. As far as credentials, they have a slew of credentials that you can purchase. You can study and then take the test. There's a lot of them. Do you need them? Certainly not. They have their flagship medical coding certification that a lot of employers look for, okay? Which is that CPC. And again, that says, outpatient coding. Well, AHIMA has that as well with the CCSP. So again, you just got to pick and choose, And with AHIMA, there is no yearly membership fee, but you do get charged to upload your CEUs if you choose not to be a member. But again, that charge is very small compared to getting charged every single year for a membership like they do with AAPC. But again, different business models. It's whatever you want to do. Whichever association you want to go into is entirely up to you. You cannot go wrong if you pick one of these 4 main medical coding certifications I just said. And again, you don't need all of them because you can't get all of them, but you just need one. And I always tell new coders to start out with one. The other problem that happens when people consider this field is they start looking at the cost of everything. They look at the cost of the program. A good average program is between $5,000 and $10,000. Okay, that's a good price for an average program. Okay, but you can certainly learn cheaper with one of these other really fast-paced medical coding programs, which I tell you never to do. You may as well just throw your money away because if the program is $1,000, what are they teaching you? And they're certainly not preparing you for one of these 4 main medical coding certifications. I'm just saying. And with that said, it is unnecessary to spend $20,000 just to get a certification in medical coding. That's ridiculous because you can get a degree with that kind of money. But again, if people don't know, or if they're saying, well, this is the only thing I can apply for with a student loan. I am against student loans, 100%. Do not believe in student loans, period. There are ways of getting your education paid for, number 1. Number 2, that's why I always have my independent study list in the description box, which I have updated the books that I recommend to 2025, because when I have put older books on there to try to save y'all money, to try to, you know, give y'all a break, because you can learn from an older book. It's going to have 85 to 90% of the same thing that a current version has. But I always get the, well, Blue, what about this? What about this? Okay, so you know what? Not going to save y'all money then, because that's not what y'all want. I gave all of y'all the 2025 versions, except for the two books that I recommend, which is the ICD-10 CM and ICD-10 PCS Coding Handbook with the Answers, and the CPC Study Guide. Both of these, I tried to find them on Amazon that were the 2025 versions. They do not have these. They do not have the 2024 versions either when I looked, okay? So maybe if you look, maybe you'll be able to find a 2024 version. And then like 2023, I think they had like one copy left. And so I was certainly not going to put that link there. So I did put the one that has the most, which I think it's, what is it? 2023, I think. Or no, maybe it's 2021. It's 2021. Yeah, that's the newest that I could find. Yeah, 2021. That was the newest one I could find. And the CPC Study Guide, the newest I could find there was 2022. Okay, so you can go to any retailer and find these books in the 2025 versions if you want to, but these are just the Amazon affiliate links. You don't have to click on these because I make it a small commission if you do, but the title is there. So again, there's no obligation to you at all to even go through Amazon, all right? You can do whatever it is that you want to do, get your books wherever. But like I say, you don't have money to spend, fine. There's the books, literally the list of books there, and I have the independent study list that has all of the syllabus and the recommended book links and all this other good stuff. So you could, in theory, just purchase the books on your own or go to the public library and check them out. Now, you may not be able to find coding books that are current, but you may find some that are close enough or very helpful. So something that you could use in the meantime to get yourself studying. Again, when I have that independent study list, I have all of the links and everything on there so that you can practice with that stuff. If there's an old link, maybe you're watching some of my older videos, if there's an old link, then obviously clearly just go with the current year. You can always Google it. It's that easy, okay? Pathophysiology, pharma, medical terminology, human anatomy, and physiology. These things don't change, guys. You can go to the public library and get that for free. Or you can go on YouTube and there's a ton of channels that talk about like medical terminology, anatomy, pathophysiology. There's tons of them on there. So that way it can kind of help you to stay engaged. You're not having to put out all of this money, okay? It's unnecessary, all right? When you can look at these resources here that I give you guys for free. I don't ask y'all for nothing on this. It's there. It's the information that's there. And so there's also Just Coding, justcoding.com, right? If you go to justcoding.com, they have a free subscription and they have a paid subscription. If you sign up for the free subscription, right, they have 5-question coding quizzes that you can use to help you practice. And so if you don't have a workbook right now, you can certainly use your coding books to look up those codes and things to see if you're on the right track. And if you complain, because I've had people complain before, they're too easy. Well, are you looking at the multiple choice? Because you can always cover them up. And then you can try to look at look up the code on your own by yourself and see where you are without having to look at the multiple choice. It's that easy, guys. But yes, I will say that. So if this is something that you want to do, obviously it doesn't have to be a big investment immediately, okay? The investment really starts when you start getting your certifications and things like that, your certification. That's when it really starts to you can start seeing it. And of course, when you get your books, right? You got to get your coding books, your current coding books, because the coding books have to be current, depending on when you're taking the test. But it does have to be current. So 2025 editions, you should already be in those, okay? So that way you can start seeing where you are. But with that said, your life is what you make of it. If you want to switch careers, if that's something that you want to do, and I think because it's the time of year that we're in December, and we're staring down the barrel of a new year. And sometimes people want to say, okay, this is the year that I'm going to change everything and everything's going to be different. It doesn't have to start on January 1, guys. It can literally start Monday. What is it? Monday, December 9th. It can start on Wednesday, December 11th. It could start any day that you change the course of your life, the trajectory of your life. That is possible for anybody. But the more you sit there and you question, and the more you look around and you ask people who are not in the field or who are just as lost as you are, then you start to get that energy from them. And maybe they're not the most positive, and then all of a sudden you lose steam on your dream. Don't do that, guys. Don't lose steam on your dream, the thing that you want to do, because you want to get into coding, because you want a career that's going to challenge you and keep you engaged and keep you interested. Not that you're going into a career because, oh, it's really high pay and they said this at the school and I can travel and all this other garbage. Don't listen to all that garbage. You got to look at the bare bones. What is it about? It is about keeping up on our knowledge and being willing to be adaptable and do all of these things. To work in person if you can. My East Coast, West Coast people, I understand that there is a space issue. I get it. Oftentimes my California people and my New York people will tell me, Bleu, they don't have in-person coders. And I understand that. It's unfortunate. But I understand it. But if you can, anywhere else, right? If you can, your first job, be in person. That is the best for you, okay? That is the best option for you because you will have access to people who have experience and their mentorship, okay? Because there's things that cannot be taught in books. Somebody commented a really sweet comment the other day. They said, Bleu, you teach us things that we cannot learn in books. And I think that that's very sweet. I love that. And it reminds me that I am actually doing something. I am actually helping people, because sometimes I just I wonder, but with that said, good luck out there, guys. If you're going to decide something, go in it. Do it. Quit asking questions about it, Give yourself permission. Give yourself permission to say yes to a career and have the discipline to show up and start and go every single day. It doesn't matter about motivation. Motivation is a fleeting emotion. You have to have the discipline. In order to be successful, you've got to have the discipline. And discipline is showing up even when you don't feel like it, even when you don't want to, even when you are tired. And if you are tired right now, you're telling me, Bleu, I'm so tired. I know you're tired. I know you are. But it's going to be okay. This is not forever. It is just right now. While you're making this decision, if you're feeling that fatigue and that tiredness, you think about why you're leaving that career that you're currently in. You think about what your situation is right now that's keeping you from enjoying going into an office or going into a new career and starting in something that you're going to enjoy. You think about that, okay? But trust me, guys, this fatigue that you feel is temporary until you make a decision for yourself. And until you make that decision, you make that commitment, and you get the determination in you to be able to do this career, guys, you're going to be floundering if you don't, okay? And I don't have to say this, but life, quick, very quick. So make a decision and go with it. At least that's my advice anyway. So with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see y'all next time. Bye.